My name's Scarlett and I'm a harm reduction worker at QuIHN in Bowen Hills.
My name's Isha and I'm a peer harm reduction worker at QuIHN in Brisbane and in the Gold Coast.
QuIHN's an alcohol and other drug service. We're pretty great because we're not an abstinence-based service, so we meet people where they're at, and we do a huge range of different ways of helping people out, including things like groups. We have a needle and syringe program where we do lots of harm reduction interventions. We have a lot of amazing peer workers, so meeting people where they're at, including people who have lived experience doing that work. And then we have a whole therapeutic range of services as well. We span from the Gold Coast all the way up to Cairns on the east coast of Queensland.
Point of care testing is a Hep C test and it comes back within 50 minutes. It's just a prick of your finger and we give you the result.
The key messages that I would give to clients when they're doing point of care testing is just about how quick and easy it is. What we do with their information as well that they're giving us to do the test, which is all that it's private and confidential, and also what they can expect in terms of the time frame of results and what happens after they get results. So if they're needing follow-up into our treatment program or if they just go about their day.
So our clients do have a fair few questions regarding point of care testing. Some of them are really worried about getting venous access because they don't have veins, and we explain it at QuIHN that it's really quick and easy. We don't need veins, we just need a prick of your finger and some blood, and that's around about it. So they're pretty convinced about that. I think the main benefit of getting a point of care test is that you get your results back that day within 50 minutes, and so you're not going home and worrying about what the results are going to be.
I've had a lot of clients come through who, have issues with mainstream health services, and QuIHN is the one organisation that they actually have a relationship with, and so we have trust built up. And to be able to offer access to testing and treatment and be able to do that in a way that feels safe for that person, and then to know that they've cleared the virus and, it's just one less thing that they have to worry about. It's been really awesome. I think that's the best thing.
My name's Isha and I'm going to be doing the point of care test with you today.
So after the client comes in, we explain the process. So we got all the equipment ready out on the table, which is the gore, the pricker, the pipettes and the swabs. We grab the swab and swab the finger. It's recommended to take a sample from the third finger of the non-dominant hand to make it easier to get enough blood. Next, we grab the pricker and prick the finger. We get the gore and we wipe the first bit of blood off. Then we squeeze the finger to get some more blood. So we need to fill this up right to the white line. Sometimes it takes a few goes. Next, we grab the cartridge, we open the cartridge up. We put the pipette in it and we push down on the pipette. So all the blood we've just taken goes into the cartridge. We dispose of the pipette and the pricker safely. Then we get a band-aid and put it over the finger. Then we take the cartridge over to the machine, we scan the cartridge and then press start test. The light on the machine will come on, so you know what door it is. We open the door up, insert the cartridge, we close the door, and then the test is running. Next, we clean up all the equipment and we dispose of it into the clinical waste bin. The test takes about an hour. After it finishes, we open the door and grab the cartridge and then dispose of the cartridge. Then at the end, we have a result for the client and it's all finished.
Thanks so much.
No worries. Have a good
See
day.
ya.
Bye. Where I explain the next steps if a client does come in positive, I let them know that they're positive and we go through the treatment options. I tell them about our nurse practitioner that will be giving them a call or seeing them face to face and saying that they're not judgmental, you don't get stigmatised, they're just exactly like one of us. So our clients are usually really happy after they see our nurse practitioners, because when they usually hear about a nurse or a nurse practitioner or a doctor, because they've been traumatized through the normal healthcare system, they're a bit iffy on it. But I've had a lot of really clients come back with really good and happy results, going she was wonderful and thank you very much for putting us on treatment.
So treatment usually either takes 8 or 12 weeks. So it's a series of tablets that you take daily. And it just depends what form of medication you're on, whether it's going to take 3 tablets a day for 8 weeks or 1 tablet a day for 12 weeks. But yeah, it's very quick and easy, and there's very minimal side effects. The advice I would give to any organisation that wants to start point-of-care testing as a service is that it is really easy for all of your staff to learn. The training is really great. There's a lot of support from the organisations that do maintenance on the machine. So it's easy to set up, and the benefits for clients are massive.